Top of the morning, Dan and Amy, continuing our COVID conversation. A new study from NYU's Langone Hospital System reports its mortality rate declined by 70%. COVID-19 mortality rate declined by 70% from March to August after accounting for age, health risks, admission, vital signs, and other factors. The Houston Methodist Hospital System reported its mortality during the early summer surge was about 3.5% versus 12.1% in the spring. Deaths have also trended lower because the public is doing a better job of shielding the elderly and those at high risk, so opines the Wall Street Journal. The CDC reported last week the share of deaths in nursing homes declined by 45% between May and August. Individuals over the age of 85, 630 times more likely to die than those between 18 and 29, says the CDC. You wouldn't know it to listen to the reporting on this and listen to politicians like Illinois Governor J.B. Pritzker inveigh on the topic.
On Friday at 12:01 a.m. in the city of Chicago, and tomorrow at 12:01 a.m. here in suburban Cook County and in Metro East.
Sorry, that's wrong. You talked about, it's in the air. So wherever you are with other people, you're going to get it. It's not if, it's when you're going to get it. Spreading fear and panic.
The 7-day U.S. rolling case average has doubled from the recent low in mid-September. This includes New York and its neighbors, whose governors were hailed for supposedly controlling the virus, so rising even in states with strict restrictions and mask mandates, including in states like Illinois that weren't hit as hard as earlier.
Yesterday, 4,000 new cases of COVID, 46 deaths.
And yet, with notable exceptions like El Paso, there is not a situation where healthcare systems are being overwhelmed. It just gave you some of the reviews of the significant decline in mortality associated with infection. And yet, the hysteria not only is unabated, it seems to be increasing. I wonder if the mortality rate and the hysteria associated with COVID-19 actually have an inversely proportional relationship. The less deadly the disease gets, the more the hysteria spikes.
Or it could be that there's an election.
For more on this, we're pleased to be joined by Stephen Novella. He's an academic neurologist at Yale University School of Medicine. He's the president and co-founder of the New England Skeptical Society and author of Neurologica blog. Professor Novella, thanks for joining us. Appreciate it.
Professor?
Do we have Professor Novella?
Hello.
Okay, let's go try to get Professor Novella, and we'll come back.
AM560 mobile app. Download it today at 560theanswer.com/mobile.
The Lou Dobbs Financial Report is brought to you by Signature Bank, helping local businesses succeed. Visit signaturebank.bank for your commercial banking needs.
I'm Lou Dobbs. 3M says its third quarter was boosted by sales of masks. A top Facebook executive in India steps down. Durable goods orders up nearly 2% in September. Those stories next. You've all probably heard of asbestos and know that it's dangerous. And you may also know exposure to asbestos is the only known cause of mesothelioma, a deadly cancer. People who were exposed to asbestos decades ago are being diagnosed to this day with mesothelioma. That's because it can take as many as 30 or even 50 years to develop. But did you also know there's money to pay victims of asbestos exposure from years ago? An estimated $30 billion available to help compensate victims and their families. If you or a member of your family have been diagnosed with mesothelioma, you may be able to receive some of this money without ever going to court or filing a lawsuit. Get a free legal review today. Call Sokolov Law at 800-910-1950. That's 800-910-1950. Minnesota-based 3M says sales of N95 masks and other items to combat the China virus generated $235 million more in the third quarter than a year ago. 3M says before 2020 is over, it expects to sell more than 2 billion N95 masks as the pandemic continues to change the global economy and the way people work. Durable goods orders an impressive 1.9% higher in September. Facebook's top public policy executive in India stepping down after she refused to apply hate speech rules to a politician from the ruling Hindu Nationalist Party. Internal audits suggested party leaders were at the center of posts promoting violence. India is one of Facebook's largest markets, and political controversy isn't welcomed by the social media platform there. Please join me for Lou Dobbs tonight, 5 o'clock and 7 o'clock Eastern on the Fox Business Network. This is the Lou Dobbs Financial Report.
AM 560, The Answer.
Now we're pleased to be joined by Professor Stephen Novella, an academic neurologist at Yale University School of Medicine, president and co-founder of the New England Skeptical Society, and author of the Neurologica blog. Professor Novella, thanks for joining us. Appreciate it.
Thanks for having me.
And so my question, it seems as the mortality rate declines for those infected by COVID-19, the hysteria over caseload increases. Is that your sense?
Well, listen, I wouldn't call it hysteria. I think this is absolutely appropriate concern. This is still an extremely contagious, extremely deadly virus. We are now heading into a third surge, which looks to be bigger than the first two. And we're heading into the winter months where people tend to be indoors more. And experts and physicians, I think, are reasonably concerned about that. We are not seeing even the light at the end of the tunnel of this pandemic. So we still need to take it very seriously.
Oh, I'm taking it seriously, but do we know even which phase of the surge we're in? Tony Fauci said just this week we're still in the first phase.
Yeah, we don't know because we're in the middle of it. We'll have to look back and see how it all plays out. But we're definitely in the middle of a third surge, or you want to call it a peak or a spike or a surge or a wave or whatever. You know, some people think we're in the third peak of the first wave, if you will. But it's hard to say until we'll be able to look back on it and see what the full scope of this pandemic is. But pretty much 100% of respiratory pandemics throughout history have multiple waves. That's just how pandemics roll.
Well, we're never going to eradicate COVID. So, and a lot of people are wearing masks and there's a lot of lockdowns. Nothing seems to be working. What do you suggest?
Well, things are working if you consider what your goal is. I mean, yeah, eradication in the middle of a pandemic is not going to happen. Viruses that have non-human hosts don't get eradicated anyway, like the flu. It's always going to be with us to some extent. But the goal is flattening the curve is still a very important goal. It's become a cliche, but it's really important. One of the reasons the mortality rate was so high initially, especially in the United States, the Northeast, New York got hammered. Hospitals were overwhelmed, and that in and of itself dramatically increased the mortality rate. And just by taking the pressure off of ICUs, off of hospitals, it is one way to reduce the morbidity and mortality of not only direct COVID infections, but downstream effect on other problems. People have had more heart attacks and died more of heart attacks and strokes because the ICUs were overwhelmed, and then people weren't going to the hospital. So there's lots of downstream effects as well. And we also have to consider the non-fatal outcomes of this virus. Now I'm a neurologist. I'm seeing patients who survived COVID in the spring or maybe over the summer, and now they have chronic symptoms, chronic fatigue and other symptoms that are probably due to having had to deal with this virus. It'll be years before we really know the full healthcare implications of this pandemic.
And again, yet despite the increase case, the surge that you described, hospitalizations are still 30% below their spring and summer peaks. So to flatten the curve to protect the healthcare infrastructure, that is not really in crisis across the country at this point. And it seems like actually we've moved well beyond that. The nomenclature continues to evolve, as a politician might say. It was flatten, then it was slow, as in the spread. Now it's stop. We can't stop. We can't stop it. You just said that. So why do we have people saying we can?
Well, we can reduce it, right? I mean, the pandemic is going to run its course. And essentially, most experts are saying that we're buying time until we get a vaccine.
Mm-hmm.
And the vaccine is really going to be the only meaningful way to bring this down to non-pandemic levels where we can get back to some kind of normalcy. And until we get an effective vaccine that we can widely distribute, we want to minimize cases as much as possible. Because even though, comparing our current mortality to what was there in the spring gives you a false sense that this isn't a deadly virus, but that's not true. Again, those early numbers were elevated for a number of reasons. One was because hospitals were overwhelmed, especially in New York, but also because there was a lot of vulnerable people in the population. One of the reasons the researchers of the study that you mentioned, there's other studies, one out of UK, for example, that showed that ICU mortality decreased from 41 to 21%. 21% is still huge for any illness when you're talking about death.
Mm-hmm.
But part of the reason is that the most vulnerable people, to put it bluntly, have already died from this pandemic. So the pandemic is moving on to people who are healthier at baseline. Also, the measures that are being used, like when you wear a mask, it not only reduces the probability that you'll get sick from the virus or that you will spread it to other people, but if you do catch it, you'll probably get a smaller amount of virus, and so you might get a milder illness. So mask wearing and social distancing is shifting to less severe infection and also avoiding the infection. And so we're having an increased number of people who are getting sick, but they're not as sick, and they're also healthier at baseline.
But isn't that
So again,
because
that's
we have
just
better
sort of as
therapeutics, though, too?
Yeah, and we're also getting better at treating it, no question. It's not so much the therapeutics as well, just that doctors understand this virus better. So there are things that, like, we know to delay ventilation as long as possible. That ventilation actually could damage the lungs if you started too early in a patient with this illness, or that you want to rest people on their stomach rather than their back can help in some cases as well. But yeah, one of the biggest discoveries actually was the fact that steroids are useful. And steroids are not a new therapeutic or not a new intervention. And with any serious infection, we always have the question, what's worse, the infection itself or the body's immune reaction against the infection? And in this case, in seriously ill COVID patients, the immune response is causing most of the damage. And so using steroids to basically throw water on that fire really improved outcomes.
Like dexamethasone.
Convalescent plasma is also helping. The other ones, not so much. Remdesivir, its latest study did not increase survival. Hydroxychloroquine hasn't been effective. So other things, the therapeutics are coming, but there isn't really any game changer right now. Although I think that steroids are probably the most effective intervention that we've taken up.
Like dexamethasone.
Yeah, dexamethasone is a steroid, correct.
So the virus is definitely deadly, but again, individuals over the age of 85 are 630 times more likely to die than those between 18 to 29. Under 50, you basically have a more likely chance of dying from the flu than you do COVID-19. So those signatories of the Great Barrington Declaration, more than 20,000 doctors and public health professionals from around the world, led by Stanford, Harvard, and Oxford in terms of at least known infectious disease experts from those universities. Do they have a point when they say lockdowns, bad idea, focused on those who are vulnerable, particularly at this stage, better idea? That's the smarter public policy, to be more surgical?
No, I don't think so, for a few reasons. And I think the notion that we are going to get to herd immunity is we're learning. Again, we're in the middle of this. It's a novel virus. We're still learning a lot about it. But what we know now predicts that's natural herd immunity is not going to happen. The immunity you get from getting infected and surviving the infection tends to wear off very, very quickly. And the number of people that would need to get infected in order to provide any kind of herd immunity would lead to millions of deaths in the U.S. And that's not, I think, a path that we want to take. Just giving up and letting the pandemic run wild and just saying eventually it'll burn itself out or we'll get to herd immunity naturally is not the way to go. And I think that's the majority, the strong consensus among experts is that we should not try to do that. We want to keep the numbers as low as possible until we can get some serious therapeutics, but really specifically a vaccine. And the other thing is we know that there's saying quote unquote shutdown, that's a lot of territory, right? That's not one thing. We know that wearing a mask and social distancing works. It works really well. It's the most effective measure. It can save tens of thousands, hundreds of thousands of lives. And so there's really no scientific controversy about that. When you talk about shutting down, there's a range of things that can be done, and that should be individual to the local situation. Are you talking about just no groups over 50 getting together, for example, or no indoor restaurants, or like closing down theaters? This is not shutting down the economy. This is just limiting the kind of super spreader events that really magnify the pandemic. And so those are very local decisions that need to be made based upon how the virus is spreading through a community. There's
a lot that you just said that I'd like to explore, but let's stick on the lockdown piece. So, should child care centers be open? Should children be in school?
So for young children can catch and spread the virus. They can spread it to their parents, but they are definitely not as vulnerable to it as older populations. And so it's all risk versus benefit, right? I think the risk to younger children is less, and the benefit of them being in school is definitely significant. The American Academy of Pediatrics said kids really need to be in school, like at the elementary school age, and we should make every effort to do that. So I think for that particular situation, for example, the issue may come down to, well, what do we have to do so that the schools can safely remain open if they are already open, or
but 33 states don't live like this.
Well, just on the matter of children, I mean, your researchers from your university looked at 57,000 child care providers across all 50 states and concluded, I'm quoting this published in Pediatrics, the journal, that children did not contribute to the spread of the virus to providers.
Yeah, no, as I said, I mean, they can catch the virus. They can be spreaders.
Well, anything's
but it's
possible.
not significant.
I could fall off a roof.
I mean, anything's possible, but what does that study tell you about how should that inform our policy, or should we just ignore it out of an abundance of caution and say we?
No, but you have to. We're not ignoring that, but you have to put that into context. That's with precautions, right? That's not without precautions. So yeah, absolutely, it's as I said, it's reasonable to have things like daycare centers and schools open, but with precautions, with mask wearing and social distancing, and not having too many kids in one room, et cetera. And we all know, I mean, if you have small kids, you know how hard it is to get them to comply.
I think
rules.
kids
so the infrastructure has to be there for them.
I completely disagree. I think kids have been very compliant. I think kids have been very compliant with wearing masks and washing their hands. It's part of their day. It's part of their lives now.
Have you actually been at a school with small kids?
No, my sister teaches, and she tells me, the masks come off. They know that if they don't have them on, they're not going to go to school. And these kids are dying to go back for in-person learning, so they'll do whatever they have to do.
No, I agree that you can motivate kids to do that, but young children, it's harder to get them to be compliant than older kids or adults.
Okay.
Their attention span is not as long as it would need to be compliant throughout the day. Seeing this firsthand, it's very quickly. They touch everything, the masks come off, they get close. They don't understand the social distancing thing.
But we can't.
But you can get it to work. You can get it to work if you have the infrastructure in the school. So if the schools have enough support to limit class size, limit the number of kids in a room, have some kind of dividers if necessary, to enforce mask wearing, make sure there's enough adult to student ratio, and